Now, a new super hospital is set to open its doors to patients next June. And when it does, it will be a British first. It will be the first to be fully staffed by specialists for emergency care to patients 24 hours a day, 7 days a week.
Today, the Medical Director of NHS England, Sir Bruce Keogh, visited the site near Cramlington for an official ceremony and to see the progress on a facility which he believes will be the future for A&Es. Katie Oakes was there for us.
It's another milestone for the future of emergency care in the North East. Today, Sir Bruce Keogh, the Medical Director of NHS England, joined specialists at the site of a new hospital near Cramlington for a topping out ceremony.
My first impressions are that this is absolutely fantastic. As you know, we've done a review recently of urgent and emergency care services throughout England. And we've laid out a vision for what those services should look like in the future. And I'm really impressed with what I've seen here. I think it reflects great ambition. And I think once this is open, this will be something that you can be really proud of.
When it's finished next year, this building site will become the first hospital in the UK to be dedicated to emergency care.
This will be staffed 24 hours a day by a consultant in emergency care, and will have 9 consultant-led speciality teams working extended working days just to deal with emergency care. So we believe that will be an unparalleled level of expertise we'll be able to offer.
This site has been 15 years in the planning. Permission to build was granted in 2011. Work started a year later, and the first patients will be admitted here next June. But it initially attracted criticism from residents who said traffic would be worse, from doctors in Newcastle who said it was too close to other hospitals to be worth building, and from patients who'll no longer necessarily be treated at their nearest hospital.
All A&E departments are not equal. They won't be equal in the future, and they're not equal at the moment. Some departments do some very high-ended procedures, and others are minor injuries units. From next year in this area, this is where you will come if your GP wants to refer you to hospital with an acute illness, or if an ambulance wants to bring you to hospital, or if you've got anything other than a minor illness or a minor ailment. This is the building that you will be treated in, and that you'll be treated very, very quickly to high standards.
60,000 patients are expected to come here every year to be treated at a facility considered the future of A&Es. Katie Oakes, ITV News.
You're watching ITV News for Tyne Tees. Still to come this evening, we will preview Hartlepool's League 2 clash with Southend. And they're often in the region entertaining the crowds at events like the Great North Run and the Sunderland International Air Show. We've got news on one of the biggest changes to the Red Arrows in 5 decades.